Hello and welcome to Geneva, the World Economic Forum. My name is Adrian Monk. Delighted to welcome you to this Asia media briefing in partnership with the World Health Organization. We have a great panel this morning for you, or this afternoon where you are, which is Dr. Takeshi Kasai, the Regional Director for Western Pacific with the WHO. We have Tan Sri, Dr. Rebecca Fatima Stamaria, who's the Executive Director of the APEC Secretariat. We have Tan Hui Ling, co-founder of Grab, based in Singapore. Also from Singapore, Warren Fernandez, Editor-in-Chief of the Straits Times and Chairman of the Asia News Network. And of course, you and your questions. We're going to start the briefing, though, with going to Dr. Kasai for his introductory remarks. Dr. Kasai, over to you.
Thank you very much, Adrian. 4 months into the COVID-19 epidemic in the WHO Western Pacific regions, we have more than 164,000 confirmed cases and around 6,600 people have lost their lives. Countries and areas across our regions are at a different stage of pandemic. Except Hubei province in China in the earlier months of the outbreak, none of the countries in the regions have had a large-scale community transmissions. While we are relieved that, for now, the Western Pacific have averted the worst, we are conscious that the pandemic is far from over, and countries should continue to prepare for the large-scale community transmission by engaging communities and strengthening healthcare capacities. The key to control COVID-19 in these regions has been proactively finding and isolating the cases of COVID-19, tracing and quarantining the contact, and introducing a stringent public health distancing measure, including a movement control, comparatively early in the outbreak. They have averted what would have been devastating consequences in uncontrolled COVID-19 epidemic. Hospitals have not been overwhelmed and many deaths have been prevented. But we must also recognize that the socio-economic cost of some of these control measures have been enormous, especially for the most vulnerable. We are facing a profound, complex challenge. How to control the COVID-19 in our communities, while at the same time bringing back our economies and societies. As long as the virus is circulating in this interconnected world, and until we have a safe and effective vaccines available, everyone remains at risk. So we have to find a way to live with this virus for now. And this is what we call the new normal. 3 weeks ago, I mentioned that there's no one-size-fits-all approach to lifting the public health and movement controls measures. The effectiveness of each of these measures and what each society values differs by countries and by cultures. What remains true across different country contexts is that the process shouldn't be rushed. Easing restrictions too quickly would bring on a resurgence of diseases. It needs to be done in the phases based on scientific evidence and the data on the local context. And when restrictions are eased, the key to control the virus is to ensure well-functioning system to detect and isolate cases and trace and quarantine their contacts. It's understandable that everyone's eager to move on. And in the Asia-Pacific region and beyond, WHO is working with the countries on how to ease measures safely in a way that protects public health, prevents new waves of infections, and allows society to regain some degree of normality. We want healthier customers, workers, and then students. We need our offices, restaurants, markets, schools, transportations, and place of worship to be a safe place to work, learn, and connect with our communities. COVID-19 has reminded us of the extent to which everybody depends on health. And each one of us actually can contribute to securing a healthy future and building back our societies and economies. Each individual's willingness to maintain healthy practice that protect not only themselves, but their families, friends, colleagues, communities, healthcare workers, and vulnerable around them is the foundation of ability to rebound. We are in this together and can only get out of this together. In moving forward, we should create a new normal in which we don't have to choose between health and livelihood. Rather, we should bring up both. The big decisions on how to do this needs to be made together, bringing the health sector, economic sector, and community together at one table. I believe we can do more than just go back to evaluations of the way we did business and deliver her services before COVID-19. This pandemic has fundamentally changed the world we live in and at the lightning speed. It has also presented us with an unprecedented opportunity to fix the flaws and fractures in our health systems and societies that COVID-19 has exposed. Today, we can work together to shape a new reality, commit to new ways of thinking, living, and working that will make us safer from COVID-19 and other threats in the future. Government are, of course, central to steering us through this. They need to ensure gradual, flexible, and clearly communicated approach to lead us into this future. The private sector can play a critical role in adopting flexible and innovative ways to reopen and conduct businesses while taking necessary steps to reduce the risk of infections in the workplace. It is also about identifying new opportunities to deliver goods and services that are better than those we had before. There are many people's families and businesses facing difficulties under stay-at-home orders and temporary business closures. I know how hard government across the regions are working to fight both the virus and the hardship it has caused to maintain societies. It is not an easy journey, but I think it's time for all of us to do our part and work together to realize our new future, a more caring, stronger, healthier society for everyone. Thank you very much, Adrian.
Arigatou gozaimasu, Dr. Kasai. And you talked about the health impact across the region. The economic impact is also something that is on the minds of policymakers, governments, businesses, and citizens. And probably no one's tracking that better than the APAC Secretariat. Dr. Rebecca, thank you very much for joining us from there. Can you tell us a little bit about the perspective you have on the economic and social impact of this crisis?
Thank you very much for having us here. Let me just focus on the economic side of things, as you mentioned, Adrian. But before that, let me also echo Dr. Takashi's point about collective action, and that's what we're trying to do in APAC. Our focus is, of course, on trade policy, and trade policy that provides access for the much needed medical goods that will save lives, especially in this context. Is the importance of keeping our markets open, working together to deliver a free, fair, non-discriminatory transparent, predictable and stable trade and investment environment to ensure that trade and investment continue to flow, especially at these trying times. Our concern has to be on the impact on the most vulnerable in our economies, as well as vulnerable economies. Trade is an important tool to facilitate access to medical goods, to cope with the challenges that we're facing, specifically access to PPEs, to masks, rubber gloves, etc., all the medical goods that we require. Export restrictions on medical goods, if we understand that, based on the situation, some economies have put in some restrictions because of the pressing need. And that's even in the WTO, that's allowed in cases of emergency, health emergencies. But what's important is that we ensure that these measures are appropriate, are proportionate, are transparent, and are temporary. I think that's important. And in APEC, we work together to ensure that these are principles that we abide by. And moving forward, governments really need to provide greater support for the healthcare system and social protection. Our policy support unit, the APEC policy support unit, has done some work on the healthcare situation, specifically on the global supply chains, keeping global supply chains for medical goods more open. And based on, just to give you a perspective of where we are in APEC, based on 2018 data, global trade in medical goods to support the fight of the virus is significant, amounting to almost US $1 trillion. APEC economies account for 40.8% of global import value of medical goods, and 28.8% of global export value. More than 90%, this is important, more than 90% of trade in medical goods in APEC involves 10 economies out of the 21. So it just gives you an impression of how it's concentrated. The trade is very concentrated. Most of the APEC economies also apply low most favored nation tariffs for medicines, medical equipment, but we impose higher tariffs on medical supplies and PPEs that are essential for this pandemic, coping with this pandemic. Trade policy also, from our perspective, is important to facilitate access to these goods. And therefore, at the forum, we are working to make sure that we collectively discuss and look at initiatives to perhaps not permanently reduce or eliminate tariffs, but at least commit to avoid implementation of unnecessary trade restrictive measures, export restrictions, and we commit to keep supply chains open and functional. Also, we have accumulated or obtained data, latest available data for the region, and we found that 4.1 on an average, the region has 4.1 hospital beds, 1.9 physicians, 3.9 nurses per 1,000 people. Now, these figures represent an improvement since the SARS outbreak of 2003, but I think we need to do even more. So this gives you a perspective of what we have, what APEC is the data that APEC has collected. The impact of the virus is serious in our region. We will see growth declining. We will see loss of jobs, and therefore there's a lot that we're all committed to these initiatives to better our positions in the region. We are really looking to ensure that we commit to keeping our markets open. I keep saying this because it's so important that at these times we not retreat into protectionist measures, but look to collectively work together to support each other in this endeavor. So greater support for healthcare system, encourage members to act swiftly to make sure that we keep of medical supplies and equipment, and access to even essential goods affordable. I think that's one of the important things, and those are things that we discuss in APAC, and we hope that collectively the collective effort will ensure that we all come out of this together in a better shape than we are in now. Thank you.
Dr. Rebecca, thank you very much for that. You talked about the economic impact. There's probably a few people better placed to judge that than from the private sector. Grab, delighted to be joined by the co-founder, Tan Hui Ling. And Ms. Tan, your business really is probably on the front line of some of the economic impact of the pandemic so far. Can you give us a perspective on its impact on business generally, on your business, and also on what you want to see from policymakers and governments in response to this crisis?
Thank you, Adrian. And thank you all for having me today on this panel to discuss the impact of COVID-19 on our customers, our partners, societies in Southeast Asia. So today, Grab serves over 9 million micro-entrepreneurs in Southeast Asia using our super app platform to help them make a living as a driver, delivery, and merchant partner. Now, since the start of the crisis, Southeast Asia has seen more than 60,000 cases of this disease and 2,000 deaths. It has had a tremendous impact on the way we live. And as part of today's discussion, I hope to share with you some of the emerging trends that we are seeing on the ground and how we're also adapting to them together with our public-private partnerships as the pandemic evolves. So COVID-19 has created an immense challenge for businesses globally, Grab included. Today, if you look at cities that used to be notorious for their traffic jams like Jakarta and Manila, you will now see empty roads. What this means is that our driver partners' incomes have fallen and their livelihoods and ability to support their families are equally impacted. Similarly, many small food merchants and merchants of all sizes have seen their sales plummet because of the pandemic. So we recognize the situation our partners are in, and we are doing whatever we can do to support them. Today, Grab has committed $40 million in partner relief initiatives across the region to support our driver and merchant partners during this period. To keep everyone safe, we've also distributed over 1 million face masks and hand sanitizers and implemented a series of measures to help prevent the spread of the disease. Over the medium to long term, our goal is to get our driver, delivery, and merchant partners back on their feet by rapidly adapting our business and providing innovative solutions. What our partners are going through is actually only a microcosm of what is happening in the wider economy. So businesses need to actively conserve cash and prepare for what may be a very long winter. Companies like Grab that are also consumer facing need to adapt to new patterns of consumer behavior. These challenges will define our new normal going forward, and I wanted to share 2 key trends we already see emerging as of now. Firstly, there will be an increased focus on digitalization. Consumers will likely remain cautious about venturing out, even when the lockdowns end. This means they will continue to rely on digital channels for their everyday lives. Demand for services like online shopping, food deliveries, grocery deliveries, and telemedicine will remain elevated. This consumer behavior change will also have a knock-on effect on SMEs and how they will need to manage and operate their businesses. We foresee an increased reliance on digital channels for demand generation, product and service fulfillment, and the need to manage their supply chains virtually. As a result, logistics and last mile fulfillment services will also need to ramp up to meet this increasing demand. For Grab, we see our role as helping SMEs on a couple of fronts. Firstly, to help those that aren't online go online. And secondly, to help those who are online thrive online. We are doing this via initiatives like PASA, that brings wet markets, what traditionally was a very completely offline experience, online. We're also helping SMEs digitalize their supply chains through partnerships with agricultural ministries that make it easier for small businesses to order produce via mobile phone and have them delivered quickly. As we continue to evolve these initiatives in the new normal, we hope to partner with more companies and government agencies to enable greater digitalization across the region. The second big trend we see is the heightened awareness around hygiene and sanitization. During the pandemic, we implemented measures such as contactless deliveries, requiring our drivers and delivery partners to wear masks, and installed physical dividers in some vehicles to reduce the risk of transmission. Some of these measures will likely continue after the lockdowns lift. Post-COVID, consumers will likely prioritize food and beverage outlets that have stringent hygiene standards and may opt for modes of transportation that are perceived to lower the risk of exposure. We thus also hope to work with governments and NGOs to formulate F&B hygiene standards for food delivery and central kitchens in order to meet the heightened health and safety expectations of our users. Lastly, I want to wrap up by noting that COVID-19 is a black swan event that shows how interdependent and connected we are. The virus knows no borders. Meeting the challenge of the post-COVID world is not a task for one company or one country. And corporates need to take an expanded view of their role in society and work together with governments, non-government organizations, and individuals to keep each other safe and enable our businesses and society to thrive in this new normal world. Thank you.
Julian, thank you very much. I'm going to turn now to Warren Fernandez, who's editor of the Straits Times in Singapore, but also is chair of the Asia News Network. Warren, just want to ask you, the role of information in this crisis has rarely been more critical. How have you and your members been meeting the challenges posed by this pandemic?
Well, thank you, Adrian, and good afternoon, everybody. Well, here in the Straits Times, we are working very hard to try to stay on top of this story. It is a big challenge because it's not just a health story or a science story. It stretches across the newsroom. We're trying to cover the economic implications, the social implications, the political implications, because that's what our readers are interested in. So it's an entire effort across the newsroom. And we're also trying to sort of not just report the news, which comes at a relentless pace, but in a way forcing ourselves to take a few steps back to think about and analyze and interpret and explain the news. And these are very bewildering times for all our readers. And we find that the effort to help them sort of join the dots and see where things are going is something that is especially valued at this time. We have a platform called Ask the Straits Times, where it's an interactive platform and people can send us questions that they have, burning questions on their minds. And we've had thousands of these questions come to us, and we then speak to the experts and try to get answers. We've convened panel discussions with the experts, which have been very well received. And we've seen the audiences for these various efforts rise tremendously, sometimes 2 times, 3 times our baseline audiences. Subscriptions are up, even though we've put a lot of our COVID content, all our COVID content outside the paywall. So that says to me that there is this hunger for information, and people are trying to sort of make sense of where this is all going and what it means, not only to help them stay safe, but what it means for them in the immediate term, as well as the midterm and the longer term. And even though, ironically, even though audiences are going up, revenues have taken a beating. So for us in the Straits Times, we're still relatively robust, so I think we will be able to weather the storm. But for many, many newsrooms around Asia and all over the world, the COVID is a big challenge and that's an issue that my colleagues and I on the World Editors Forum are taking up and engaging on to try and secure the future of public service information, because we feel that without good, credible, reliable information, the kind of debates and discussions that we are having today we have a reasoned and rational debate about what to do about the pandemic and how to deal with it, how to take ourselves forward, just won't be possible. And this is not an issue just for journalists or editors, it is a societal issue. And that's why we are at the World Editors Forum, we are making that an issue front and center of our engagement and public advocacy in the weeks and months to come. So those are the issues we're grappling with. On a day-to-day level, it's all about us trying to sort of work from home like everybody else in this distributed way, trying to stay connected, which is a challenge. We're also trying to ensure that our journalists who have to be out in the field to gather information are kept safe. And we have correspondents in Singapore, but also all around the region, South Korea, China, Indonesia, trying to sort of ensure that we get the necessary equipment to them so that they can do the jobs and stay safe. And one of the things that we're also trying to do together with our partners in the Asian News Network, as well as the World Association of Newspapers, is to collaborate a lot more, share information, help connect our science correspondents so that they're sharing leads and the understanding of this virus and the new things we're discovering along the way. So collaborative efforts like that has been on the rise, and including projects like this one with the World Economic Forum.
Thanks, Warren. I want to come back to you in a moment or two for your own questions, but I want to turn first to some of your colleagues we have on the line, and first to Sam Reeves from Agence France Presse. If we can get Sam up with his question.
Hi there. Thank you very much to all the panelists. My question is for Dr. Takeshi Kazai. Oh, just a minute. Hi there.
You're back.
I'm back. Sorry, my video is off there. Sorry, my question is, thank you very much to all the panelists. My question is for Dr. Takeshi Kazai. We're seeing new clusters of cases appearing in some countries that had previously managed to control their outbreaks very well. I'm thinking particularly of China and South Korea recently. How worried are you about the potential for a second wave of infections, and how careful do countries have to be going forward when they reopen? And if you can also comment specifically on how worried you are about China and South Korea at the moment. I know those two countries are part of the WHO's Western Pacific region.
Thanks for that. Dr. Kasai, can I just turn to you to pick up on that question?
Thank you very much, Adrian and the Sam. As far as the virus is circulating somewhere in this interconnected world, and until we have a safe and effective vaccine, I think everybody's remain at risk. And therefore, the countries who is now planning to also lift the lockdown needs to continue to be vigilant. And we're also really encouraging every country to use this time to prepare for the large-scale community outbreak. The countries in our regions is try to continue to invest and then improve the system to detect the cases early and isolate, and then also do the contact tracing and quarantining the people. And testing is definitely one of the components. But actually, I wanted to use this opportunity to answer that one important thing. Testing is a very important component as a part of our response. But what is important is that the testings to trigger those public health interventions. And the countries you have mentioned have now a very strong mechanism to do contact tracing from the positive cases of the cases. And one more important thing is that from the result of the testing, they should use this result to assess the situations where they are in terms of the epidemic. But not only just the outcome of the testing, i.e. number of cases. It's important to use the multi-source information, including like a positivity rate, or we should also use the surveillance, which detect similar symptoms, such as influenza-like illness, or severe acute respiratory illness, or pneumonia surveillance. And we should also monitor the number of deaths regardless of the cause. And now we're also encouraging countries to monitor the number of the healthcare utilizations, such as ICU care utilizations. So back to your questions, how we should worry. I think we have to be continue to be vigilant as far as the virus is circulating somewhere in this interconnected world. Thank you.
Dr. Kasai, thank you very much. I think we can go now to Kamarul Haron of Astro Awani for a question. Kamarul, can we get you up on screen?
Sure. Yes. Hi. Thank you so much, Geneva. Hi to everyone. Salam sejahtera from Kuala Lumpur. This is Astro Awani, Kamarul here. My question is about accessibility and affordability, because we understand that this is a global problem. If a few countries and a few communities have access to the vaccine when we have it, but other countries and other communities don't have it, then the transmission can open up new spikes anyway. So the question to Dr. Takashi, how is WHO looking at this? Because even in previous session done by WEF or WEF, we've seen how even vials for the vaccine manufacturing is also limited, and to ramp up capacity to hundreds of millions and billions in a short time. For Tashi, Dr. Rebecca, hi, long time no see, about the tariff and the patents. For example, 60 over years ago, Jonas Salk and Albert Salvin, they donated their breakthrough in finding vaccine for polio, and that speedily helped access to everyone around the world. But what about the 21 countries or economies of APEC, and whether, at least in that 21 countries, the solidarity to ensure accessibility and affordability? And for wheeling, Grab is very, very much attuned to the gaps in logistic delivery. Even when we have the vaccine, how do we ensure that from the data approach and the logistic gaps approach that we can get it to everyone that's needed in any communities? Thank you.
That was fantastically entrepreneurial. 3 questions for the price of 1. Should we start perhaps with the economics that you raised there, Kamarul, and go to Dr. Rebecca and just talk about the affordability of vaccines and perhaps address that. Dr. Rebecca.
Yeah. Okay, thank you. Thank you for the question, Kamarul. You know, yeah, in APEC, what we're looking at is to ensure that there is a collective action to facilitate the access to medicines, to medical products, to basic things like hand sanitizers, ventilators. So working with the economies, what we've done is we've tracked the tariffs on all these products together with the WTO, working closely with the WTO and the members of APEC to ensure that, you know, if we have to do this, if you have to put in tariffs on products like this, it has to be justified, it has to be proportionate, and it has to be temporary. And to also see the larger goal of making sure that these are for the common good, and therefore work towards reducing these tariffs, if not eliminating them, ensuring that the supply chains are kept open. There is an initiative among some already started by members, specifically Singapore and in New Zealand, for example, to work together and to gain and to reach out to all members of APAC to sign on to this initiative where we work towards reducing the tariffs to making sure that medicines that are essential are accessible to everybody in the region. So there is initiatives. It will not happen overnight, I must say, but definitely there is this collective will to do this. I hope that has helped to answer some part of the question.
Thank you. Dr. Kasai, can I just turn to you on the medical and health aspects of that vaccine question?
Thank you very much for these very important questions. We see a vaccine as a global public goods, meaning which belongs to everybody around the world. So this is not something that the country who produce reserves, but should be distributed equally. The equal distributions and equal protection is the way to, at the end, protect every individual around the world. And WHO, with the many partners, launched the initiative called Access to a COVID-19 Tool Accelerator, which is to expedite the development of the vaccines. But not only that, it tries to ensure the equitable distributions of the test, therapeutics, or the vaccines against the COVID-19. And just recently, we had a very impressive pledging conference that more than 50 countries around the world pledges closer to $8 billion US. Of course, this is still a pledging, and it's up to really us to uphold and make this a pledge to come to the truth.
Thank you. And Hui Ling, as we heard, the private sector will undoubtedly play a big role in helping distribute any vaccine that arrives. Have you begun any conversations with governments in any areas about what you potentially might be able to do in that respect, or is that too far off at the moment?
Adrian, it's a great question. And Kamarul Sanjatra, thanks again for that. I think you already hit on two important points in the question itself that will be critical in that phase once a vaccine has been found and once we're trying to figure out who we can distribute it to get it in the hands of those in need. One, I think, is data, which I'm not a medical expert, GRAP isn't as well. And I think what's really important is that we partner with the different governments and ministries of health to figure out who should get those vaccines sooner versus later, because we won't be able to serve everyone immediately. And for that, data is key. We already have existing relationships, let's say, with the Ministry of Trade and Industry in Singapore, where we've been working to supply anonymized data to help them understand the economic impacts in the country and how it's trending over time during COVID in different weeks, right? And we foresee similar partnerships being critical in this larger solution as well. Secondly, I think, Kamarul, you alluded to the fact that, supply chains, how do we help with that? And the logistics fronts, also a really, really good point. And here we also have other partnerships with existing governments. On this front, I think it's the Ministry of Agriculture in Indonesia, where we've been working with them to help to distribute aid to those in need, but this is for goods rather than vaccines. Net to me, I think these two same things around helping to bridge that last mile will be very critical. We will happily partner with governments and different NGOs who will be helping and support these efforts. And I think what's really most important to us at GRAB is that we know we have a role to play and we want to play it. And we're looking forward to the great news once a vaccine is out and that we can help get it into the hands of those who need it.
Thank you very much. We have a lot of questions coming in, but if you do have a question, can you please use the Q&A function on Zoom rather than the chat function? That would be a big help. We heard from Warren earlier. Warren, I want you to come back in because you have questions yourself that you'd like to put.
Yeah,
maybe we can hear from you.
Thank you. I wanted to follow up with Dr. Kazai on this whole debate about lives and livelihoods, because obviously that's something that we are following very closely as in Singapore, because we are sort of transitioning out of what they call the circuit breaker measures. And you did mention about how this needs to be done carefully and in a considered sort of way. But looking at how cases have re-emerged in countries around us, South Korea, China, and elsewhere, I wonder if you could give us your assessment on whether countries in this part of the world have moved too quickly into lifting the restrictions, or is this really just part of the process of re-emerging from a lockdown period? So it's something that we just have to go through. That's the first part of my question. And the second and related question is testing. Looking at WHO and your colleagues have said that testing has to be part of the strategy for dealing with this pandemic. And looking at the situation in the region and the numbers that are coming out, can you give us your assessment of whether we are doing enough testing just to get a handle on the pandemic, but also enough testing to help us re-emerge from the lockdowns that we're in at the moment?
Thank you. Dr. Kasai, over to you. Dr. Kasai, I don't know if you can, we can hear you. Let me just...
Can you hear me?
We can hear you now perfectly, thank you.
Apologies. I think, Warren, I think your question has several very important questions within these two questions you mentioned. First, you mentioned that a life or livelihood. I want to take this opportunity to really reiterate now that we think the questions of life or economy is not really the questions, right questions. I even think it's a false dichotomy. It's now time for really us to think how to bring both health and also the economy bring back together. I received the questions in the past that don't you think that the economic crisis is now making more people difficult? Well, actually, this is the new diseases. We still don't know many things. But what we have observed in the past 5 months is around the world, more than 4 million people suffer because of the COVID-19. And we lost more than 283,000 people as of today. And some countries, the healthcare is actually overwhelmed, and we even lost a healthcare worker. And without a very strong a public health measure or movement control or so-called lockdown, this figure could have been much bigger. But in the same time, I think many panelists already mentioned, and even the Dr. Rebecca shared the figure of the economic impact. It's an enormous consequence. And I know there are people really struggling with this. But I also mentioned that as far as the virus is circulating somewhere in this interconnected world, we'll continue to remain at risk. And that's the reason why I really wanted to emphasize it's really now time to think how to live with this virus and come up with the new normal, which we don't have to choose life or livelihood. And from that perspective, I really appreciate this opportunity that the health sector can sit with economic sector or business sector, because I think this is really the key. Yeah. And now to mention about the lifting of this very strong measure. I don't think there is one size fits all approach. But I think what is important is you rightly mentioned that we should go step by step or a phased manner. We have to do it in a very cautious way. And in case if this COVID-19 starts to spread in the community, we might even have to reinstate the measures. This is a new. So this lifting, we might not do it in a perfect way at a very start, but I think we all have to learn as we move. And again, I wanted everybody to now think how we can move. Both we bring up health, but also economy together. And to me, the key is individual effort. Every individual.
We're struggling a little bit, Dr. Kasai, with your connection. So we're going to try and
maintain willingness to protect.
So we're going to try and come back to you in a moment, Dr. Kasai, and just try and see if we can get the connection a little bit more stable. I want to just turn quickly to Asahi Shimbun and also to John Geddes of Reuters for their questions, and we'll just see if we can get a slightly better line into you where you are at the WHO. First off, can I turn to Tsutomu Ishii of Asahi Shimbun for your question?
Thank you so much. I have a question mainly to Dr. Kasai Sensei. We monitor the situations each country, and I think there are clear differences especially the fatality rate or death rate. For example, we have now in Japan more than 600 deaths out of some numbers of who infected, which is, but for example, in the United Kingdom, it's half size of the population of Japan. Their death is more than 30,000. So how can we understand those big differences of numbers in terms of death rate? Is that there are some speculations that maybe there might be a difference in the types of virus, and if so, maybe we might have a different approach for each viruses. Also, there are some unconfirmed reports or speculations that those countries who have less deaths are countries with BCG shots or vaccinations. What can you tell us so far, which is scientifically proved? Please let me know. Thank you.
Okay, that's great questions. We're trying to get Dr. Kanzai back on the line. Just going to turn to John Geddes for a moment, just to get your question as well, John. And we were just trying to reestablish the link with Dr. Kanzai. John, can you just put your question for us?
Hi there. Sure. I also had a question for Dr. Kazai, but I can also ask one from one of the other panelists. We heard from Grab earlier about the obvious kind of impact on their business and the businesses across this region, across the world that are suffering because of this. I was just wondering, with coronavirus hurting demand for services provided by Grab's drivers and merchants, can they give us a sense of what the impact has been on Grab's bottom line from this outbreak? And for Dr. Kazai, when we get him back, he mentioned in his opening remarks about how we've been lucky enough to avoid kind of widespread transmission of the virus in this region, but that countries needed to be prepared for that possibility. I wanted to get his assessment on, is this region prepared for the possibility of widespread transmission, or does more need to be done? And if more needs to be done, where and what? Thank you.
Thanks for that, John. Helen, can I turn first to you to answer that?
Yeah, thanks for the question, John. Clearly, with the current situation and with all the lockdowns going on, business clearly has been affected. I mentioned earlier the example of cities which used to be known for traffic jams are now empty. And that has translated directly to the livelihoods of our driver partners, and also, of course, business and revenue for us. So on the transportation and ride-hailing perspective, revenue has dropped. On the other side, due to also the same reasons, which is lockdowns and social distancing, our deliveries business, which is delivery of food, delivery of essential goods, delivery of parcels, that has seen an elevated demand. Net though, it is still revenue-wise, on the whole of Grab, lower than it used to be pre-COVID. I think what's really important for us right now and how we're approaching the business is we're optimizing capital efficiency and cash conservation. Because I mentioned earlier that during this time, we're actually preparing for the worst case scenario, which is a potentially very long winter. And in that scenario, I think what's really important is that we optimize on capital efficient operations and ensuring really that we can provide the best services for our customers with the changing needs, with the changing hygiene safety requirements, and also really importantly, supporting our driver partners and merchant partners to get access to new revenue streams, whether it's from moving from transport to food deliveries, parcel deliveries, or for the merchants, just moving them from offline sales to online deliveries and sales.
Thank you for that. And Dr. Kanzai, great to have you back. Whilst you were re-establishing connection, we had a question from Ishai-san at Asahi Shimbun, who was asking really what explains the difference in the death rates between some Asian countries and the US and Europe, which appear to be more badly affected. Is this a case of different policy approaches? Is it a case of different strains? And also just a sub-question on is there any evidence that that BCG vaccine has played any role in protecting populations from this pandemic?
Thank you very much, Ishai-san and Andrew. Actually, there is no simple answer to these questions. But what is very clear to us is that, as you also noted, the countries around this parts of the world has not experienced a large-scale community outbreak. Large-scale community outbreak means more people get infected, and that means more possibility that virus might get into the vulnerable populations. But what we found a common approach in these regions is, number one, they do try to identify the case early and isolate. But not just that. They try to use that as a trigger point to do the contact tracing and quarantine. And they also arrange the facility to manage those cases who need isolations or who needs a quarantine. And then the countries in this area introduced so-called public health interventions or movement control relatively early. And to make those kind of actions, they try to do good communications. And to make all those happen, they try to make a whole of government approach, engaging also the community. And this is actually a lesson drawn from our bitter experience in 2003 SARS. And I think you mentioned about the strain. I think you also questioned about BCG. So far, we don't have any evidence that this would explain that the member states in our regions were able to stay in this stage, not experiencing large-scale community outbreak. No.
Okay. Thank you for that. I want to come back at the end to Warren, if I may, but before that, we have questions from the China News Service and from The Economist, and perhaps we can take both those questions for our panel. So first to Peng Da-Wei at China News Service, and then to Miranda Johnson at The Economist.
Okay, thank you very much, Da-Wei Peng from China News Service. And I have two questions. First question is for Dr. Rebecca, because you just mentioned the danger of protectionism. Could you please talk a little bit more about how we could, avoid the emerging of more protectionism nowadays? And my second question is for Warren Fernandez. It appears to me that the public in some Western countries, they appear that they come to realize issues such as the symptomatic transmissions and the importance of wearing a mask relatively late if you compare them with countries and regions in Asia. So do you think that it's also related to how the media report or portray the Asian countries' response to the virus? For example, when it comes to face masks or the lockdown or the tracing apps, etc. Okay, thank you.
Thank you very much. And Miranda, can I just get your questions?
Hi, good afternoon. Thank you. Yes, I have a couple of questions for Dr. Rebecca as well. Dr. Rebecca, many countries obviously suffering in the current economic storm arising from the pandemic, but certain countries seem to be faring a little better than others. And in fact, in recent days, we've seen Vietnam's Prime Minister speak about 5% GDP growth in his country this year. I wondered, firstly, whether there are any other countries where prospects look a little brighter that you could point to, and what else could be done to learn from what they're doing at the present time. And my second question builds a little more on the protectionism question we just had, and concerns rice exports in this region and how maintaining stable rice exports is important and what's being done to facilitate that. Thank you very much.
Thank you. We've only got about 5 minutes left, so if we can keep our answers concise, that would be fantastic. So Dr. Rebecca, over to you.
Yeah, can I just take Miranda's question first?
Sure.
If we're looking at the best case scenario, then some developing countries could still grow due to increased domestic demand, as they say, and the recovery in manufacturing. This is particularly when you could look at the manufacturing supply chain. So if as you know, Asia, the supply chains are so integrated, and if you see the manufacturing picking up in China, and because all our supply chains are very linked to China, especially those of us in ASEAN, so you will see some improvements there. APEC real GDP though is expected to contract this year by 2.7%. That's what we're estimating, and we will continue to see some level of unemployment. Economic activity, as you know, is almost at a standstill, but we are hopeful. You know, we're always looking at the bright side of things, and we hope that because our economies and our value chains are so interconnected, improvements that will take place in China's manufacturing will also see impact on the rest of us. Plus the diversity, I think now what's happening, if you look at how we're working, especially ASEAN +3, the work that's going on there, the integration that's going there, I am optimistic when you look at that, the work that we're doing in the region to further increase integration through the Regional Economic Comprehensive Partnership. These are all aspects that we lend cause for some level of optimism in the region. Now, on the non-tariff barriers, yes, as I said earlier, in times of emergencies, economies are allowed under WTO to, there are exceptions, health exceptions, you can put some barriers, but these have to be temporary. And organizations, fora like APEC and ASEAN, we track among ourselves and among members to ensure that, you know, these are temporary, you know, and therefore working together, the collective is always, it's very important. Regional dialogues and discussions and making sure that we focus on the greater good. I think these are things that help us to deal with the non-tariff measures. And also, like I mentioned earlier, the initiatives that we are taking, some of the economies are taking, especially in the WTO, led by New Zealand and Singapore. These are really important initiatives that help us going forward. These are also important lessons that we have learned as a result of the pandemic, which helps us to then rethink how we do trade and investment. What are the rules that we need? So those are the how do we need to strengthen our rules? So going forward, you will see that for me, the WTO is not going to be less important, but more important because of the need for us to be more transparent in how we do things in the region.
Dr. Rebecca, thank you.
Thank you.
And I'm going to turn very quickly and finally to Warren for both an answer and maybe one very quick final question, perhaps. Warren.
Sure. I wouldn't attribute the position on masks to coverage in the Western or Asian media. I think it's more to do with the experience in East Asian societies with SARS, very painful experience, which was sort of etched in memories here. And that shaped attitudes towards the wearing of masks. I think in Singapore, we were somewhere in between. We started out with our minds very focused on the experience of SARS and comparing COVID to that. We then transitioned into saying maybe it was more like H1N1. And then when more started to emerge about the virus and we learned more about it and the asymptomatic transmission, then the position on masks also changed. And I was glad that the politicians had the courage to make a change in their position as the evidence changed, rather than digging their heels in and not changing as more information emerged. And I think that's the way the media ought to encourage the discussion going forward, so that it is evidence-based and scientifically sound, and not just based on political rhetoric. So I'll end on that.
Yeah. And is there a final question that you might have that you want to pose to perhaps Dr. Kanzai, just to wrap up our session today?
Yeah, I did want to see if he could answer the question I had about testing and whether his assessment is that we're doing enough testing, both to just get a handle on the situation, as well as enough to enable us to emerge from the lockdowns as we all would like to do.
Dr. Kanzai, over to you. And we've probably got time for a yes or no on that, but as we run out of time. But back to you, Dr. Kanzai.
This is the capacity that we'll look for every countries to continue to invest and increase. But again, testing itself is not important. Testing should be a part of the overall response strategy. And as I keep saying, that the testing should trigger not just isolating the cases early, but the contact tracing, quarantine. And test results should give you some kind of information that where countries are, in terms of the epidemiological situations. But we don't use only just testing result. We have to use multiple informations. And I found very interesting because I heard a couple of times the trust. And I think now it's time for every country to show how those multi-source informations are generated and how each countries are judging their situations so that people can comfortably have a dialogue and reopen their boundary. And I also heard that very interesting comment that in the near future, the people's heightened awareness about hygiene. And I'm personally really looking for that heightened awareness is not only for yourself, to protect yourself, but it becomes not just yourself, but protect your family, friends, community, and colleagues, healthcare workers, vulnerable. I think that is the key to bring up both health and then the economy. And I'm very much looking for that kind of discussions were generated starting from these conversations. So really, thank you very much for this opportunity.
Dr. Takeshi, thank you so much for joining. And also a big thank you to all our panelists, to Huiling Tan, to Dr. Rebecca, to Warren Fernandez. Thanks to everyone who joined on this media briefing. Apologies if we didn't get to your question. We tried to gallop through as much as possible. And again, thank you for joining us and have a great rest of your day. Thank you.